In 2025, we at the Southern California HIV/AIDS Policy Research Center continued our focus on the current policy landscape. Our research aimed to inform proposed policy solutions to address sexual health and related syndemics. Across the year, we tracked over a dozen bills representing California legislation on harm reduction, healthcare access, sexual and reproductive health, and specific affected communities. A shifting policy landscape narrowed our focus to three key topics. A major part of our work looked at DoxyPEP, a new approach for preventing bacterial STIs. Early in the year, we released a brief that summarizes what we know so far about this STI prevention intervention. After summarizing current federal, state, and local recommendations for DoxyPEP, we disseminated results from our team's study of a DoxyPEP pilot. Sharing results from a real-world setting complemented what we already know about DoxyPEP. It is particularly effective in reducing STIs among men who have sex with men and transgender women. Together, these resources will help policymakers and providers understand how DoxyPEP works and what it could mean for improving sexual health. HIV PrEP policies play a critical role in the mission to end HIV. With litigation about PrEP coverage and access going all the way up to the U.S. Supreme Court this past year, as well as shifts in federal policies, we partnered in a cross-center collaboration with the Northern California HIV Policy Research Center. Together with our community partners, we detailed updates to PrEP policies that affect people's access. Keeping policymakers, providers, and affected communities informed continues to be our priority. Finally, in response to our pharmacist partners' need for law and policy analyses to inform pending legislation, SB 41, our center looked at barriers pharmacies face when implementing HIV prevention services. Our brief on pharmacy benefit managers, or PBMs, highlighted how certain practices can delay or disrupt access to PrEP. We offered analyses on proposed state legislation to evaluate how policy solutions might contribute to making pharmacy-based HIV prevention feasible. Altogether, these projects support a single mission: closing gaps in access to HIV prevention and treatment. As with prior years, the mission demands that our search for solutions remains broad. Law and policies that affect HIV and STI prevention and treatment must be coupled with inquiries related to healthcare access and the impact of laws and policies on affected communities more broadly. We hope you continue this learning journey with us as we look to a future where access to health and wellness is attainable for all Californians. To read any of these reports and explore our 2025 research, visit chprc.org.